Welcome to Roadmap to Residency. Hello everyone, I am Abhiraj. Welcome to our Club 250 Maths Micro Sessions. We will be running through some questions with you guys to help you on the journey to 250. So, what is the most likely causative organism for this skin infection? A 5-year-old child is brought to the pediatrician with multiple honey-colored cross-thread lesions around the nose and mouth. The lesions started as small vesicles and have rapidly progressed over the past few days. There is no history of fever or systemic symptoms, and the child attends a daycare facility. What is the most likely cause organism for this skin infection? Staph aureus, Strep pyogenes, Ash influenzae, Pseudomonas aeruginosa, and Neisseria gonorrhea. So the clinical presentation of honey-colored clustered lesions around the nose and mouth in a child, especially on a daycare facility, is suggestive of impetigo, which is a superficial bacterial infection. The most common causative organism for impetigo are Staph aureus and Strep pyogenes. Of these, Staph aureus, particularly MRSA, is a common pathogen in impetigo. Therefore, the correct answer is A, Staph aureus. Now let's review the bacterial infections portion of your first aid. The impetigo is a skin infection involving superficial epidermis, usually from Staph aureus or Strep pyogenes, but the common among these two is Staph aureus, highly contagious and has honey-colored crusting. Okay, Bullous impetigo has bullae and is usually caused by Staph aureus. So always choose Staph aureus. Erysipelas are the infection involving upper dermis and superficial lymphatics, usually from Strep pyogenes. Okay, now it presents with well-defined raised demarcation between infected and normal skin. So if it is involving superficial epidermis, you go for a Staph aureus. Just below that, if it is involving just the layers below the epidermis, you go for Strep pyogenes. Cellulitis is an acute painful spreading infection of deep dermis and subcutaneous tissues, usually from Strep pyogenes or Staph aureus. But the most common cause of cellulitis is hair Strep pyogenes. Often starts with a break in skin from trauma or other infection. The collection of pus from a wall of infection within deeper layers of skin is called as abscess. The offending organism is almost always Staph aureus. So when you don't know anything, just answer Staph aureus. A 28-year-old woman presents with a pruritic annular rash on her groin. On examination, there is central clearing with an elevated scaly border. She reports occasional itching and notes that the rash has been gradually expanding. The patient is otherwise healthy and denies any systemic symptoms. What is the most likely causative organism for this dermatophytosis? Candida albicans, Trichophyton rubrum, Staph aureus, Strep pyogenes, or Malassezia furfur. So the patient presentation with annular rash, central clearing, and an elevated scaly border is consistent with dermatophytosis, especially Tinea corporis, that is ringworm. The most common causative organism for Tinea corporis is the dermatophyte fungus, and among the options provided, Trichophyton rubrum is a frequent culprit. Tinea corporis is characterized by well-defined circular or annular lesions with an active scaly border and central clearing. It often occurs in areas with increased warmth and moisture, such as the groin. Therefore, the correct answer is Trichophyton rubrum. Now, let's review the cutaneous mycosis from the first read itself. So, the tinea or the dermatophytosis is the clinical name for dermatophyte cutaneous fungal infections. Dermatophytes include Microsporum, Trichophyton, and Epidermophyton. Branching septate hyphae are visible on KOS preparation with blue fungal stain, and it is associated with pruritus. Tinea capitis occurs on the head, scalp, and is associated with lymphadenopathy, alopecia, and scaling. Tinea corporis occurs on the body, usually the torso, which is characterized by the enlarging erythematous scaly rings, like ringworm with central clearing, and can be acquired from contact with infected pets or farm animals. Tinea cruris occurs in inguinal area, which is also called as the jock itch. Often does not show the central clearings in Tinea corporis. Tinea pedis, three varieties are present, which are like the athlete's foot. Interdigital is the most common, most Caucasian distribution, and have a vesicular type pattern. Tinea unguinum occurs on nails. Tinea pthiriasis versicolor is called a Malassezia species, which is a yeast-like fungus, and it causes the degradation of lipids, produces acids that inhibit the tyrosinase, and causes hypopigmentation. Hyperpigmentation and or pink patches can also occur due to the inflammatory response, less pruritic than dermatophytes. Can occur any time of the year, but more common in the summer. And spaghetti and meatball appearance on microscopy can be seen. And treatment is selenium sulfide topical and her antifungal medication. Now let's review some of the images. Okay, now the KOS mount is here, the blue staining of the KOS mount, where you can see the dermatophytoses. Now this is tinea capitis. Okay, now this option C, here you can see, is the central clearing of the ringworm. You can see here this one is white, and there you can see the redness that is surrounding there. Again, the inguinal area, jock itch, is here in the inguinal area, and this is occurring on the nails, which is the tinea pedis. And again, this is the F, that is the Mucasian distribution. Okay, like this line occurring, this line is called as Mucasian distribution. And also the figures G and H are the Malassezia spaces, causing the hypopigmentation here, and this is the microscopic image. Now let's talk about candidiasis in detail. So Candida albicans is a yeast with budding and pseudohyphae, and it causes the germ tube formation at 37 degrees Celsius, which is the diagnostic feature of candidiasis. And the immunocompetent host usually present with skin and mucous membrane infections like oral thrush, candida, impetigo, diaper rash, vulvovaginitis, polyp or angular cheilitis. Immunocompromised host usually presents with systemic disease like esophagitis, endocarditis, disseminated candidiasis. Presentation is generally oral thrush, impetigo, esophagitis, vulvovaginitis causing a cottage cheese white discharge, endocarditis causing fevers, and there may be some invasive candidiasis which can lead to septic shock. The oral thrush are the white plaque on the tongue that can be scraped off. So the question will just mention that there are some white lesions which can be scraped off. That is the characteristic feature of candidiasis and maybe the only clue sometimes to answer the question. The impetigo is a well-demarcated erythematous and itchy patches on skin folds. Esophagitis may cause dysphagia and throat pain. Here you can see this is the oral thrush, this is the esophagus candidiasis, and this is the microscopic picture of the candida. The treatment is nystatin, azoles, which are indicated for the local and systemic infections, and generally the first line is the fungus is not resistant. Ecacocandins are used for the systemic infections, and amphotericin B is also used for systemic infections, and it's the second line or in pregnant women. Thank you for watching.